Now that I've just put your braces on, it's very, very important to understand how to take care of your braces. The most important thing is to keep the plaque from attracting around your braces and on your teeth. You may ask, what is plaque? That's just a fuzzy white substance that is present in your mouth pretty much at all times. The most important thing is to keep the plaque away from your braces and your teeth in order to prevent cavities and white spots. That plaque lays against your teeth and actually produces an acid. That acid will lay against your teeth and form a white spot or a cavity. So the most important thing is to keep the plaque away from your teeth. Now, how do we do that? One of the staff members just handed you a brushing instruction kit, and what that contains is different items that will help you keep the plaque away from your braces. What we'll do now is review that with you. One of our staff members handed you a kit that looked very similar to this. This is an oral hygiene kit that contains the items that you'll need to take care of your braces. The first item that I'll be showing you is wax. This is going to be used during the first few days with your braces when you have some irritation to your cheeks and your lips. We also have a Christmas tree shaped brush, which is a very small brush. The cap on it is nice because you can cap this after you use it to place it in your pocketbook or your pocket. It is a Christmas tree shaped brush to get around the braces. We also have floss that's placed in the kit. We also have a floss threader. This is something that you'll be using in the back of the mouth with your floss to help floss between the back teeth. The final item in your kit is going to be a toothbrush. This toothbrush is a little bit different than a traditional brush because it has a V-shaped channel down the middle. I would like to thank Stephanie here for helping us out with this oral hygiene presentation. You'll notice that she has a red retractor around her cheeks right now. This is very similar to the retractor that you just had while we were putting your braces on. You won't be having one of these at home. This is just conveniently holding Stephanie's mouth apart so we can see how each one of these instruments is used. The first item we'll be showing is a Christmas tree brush. You'll notice this Christmas tree brush has a cap on it, so you can conveniently place this in your purse or your pocketbook. What we'll be doing is placing the Christmas tree brush, open there for me, Stephanie, in between each brace in an up and down motion all the way around the mouth. You can start in the front and then move to the back. The most important thing is to get this in between each one of the braces. This brush can also be used on the gum line so you can clean the plaque above each brace and also below each brace. This is very small, so we can use this around the small areas of the brace. The next item I'll be demonstrating is the floss. This is very, very important because in between your teeth, the Christmas tree brush won't be able to reach. So the floss is vital. What I want you to do is take the end of the floss, and open for me, Stephanie. What I want you to do is thread the floss underneath the wire and then grasp it with the other finger. What I want you to do is grab the floss and make a C shape around your teeth and make sure it disappears below the gum line. While you're in between the teeth, you want to go to the other side and make sure you disappear below the gum line. Now in the anterior part of the mouth or the front of the mouth, it's easy for you to just thread this underneath the wire. But in the back of the mouth, you'll notice in your brushing kit also, you had what's called a floss threader, which looks very similar to a nylon needle. Now, the way this will be used, since in the back of the mouth it'll be very hard to thread underneath the wire, you'll now take the nylon needle, place the floss through the eye of the nylon needle, and proceed to the back of the mouth to go ahead and floss underneath the wire, grasp the nylon needle, grab one piece of the floss, and pull the nylon needle. What you're actually doing is using this as a tool to help thread this underneath the wire. Some flosses actually come with the nylon needle already on the end of the floss, which makes it more convenient. Some of the drugstores do carry it that way. Therefore, you don't have to worry about two pieces. It actually comes in one piece, and you can thread it very easily. An important item that was given to you in your brushing kit was rope wax. This wax is coming in a little baggie. The wax comes in rope form. What you want to do is pull a little piece of wax off the rope and roll it into a meatball. What you use this for is any brace that may be rubbing or irritating your lip or cheek, you can place this on. The idea behind this is it cushions the brace so that it's not irritating for you. Now don't be shy. Put a large piece of wax around each one of the brace that's giving you irritation and squeeze it just a little bit. Now, once you're over the irritation, you'll no longer need this. Very easy to take off. Just grasp it with your fingers and pull it away from your brace. You can also brush the remaining wax away from your teeth if you need to. The most important item in the brushing kit is your toothbrush. You'll notice that your toothbrush has a V-shaped channel cut down the middle. What that's for is to hug the brace while you're brushing. Open up for me, Stephanie. What I want you to do is place the bristles right over top of the braces in a back and forth motion to make sure you go all the way around the mouth. Okay? Now, along the front and the back, it's very important to brush over top of the braces. Don't forget to brush your gum line also. What I want you to do is now, instead of having the bristles completely on the brace, I want you to drop the bristles down and then brush right on the gum line. This may be a little bit different than your hygienist talked to you about because you're not going to be as much in a circular motion than a back and forth motion. You also want to go on this side of the brace also to make sure that you clean all the plaque from that side of the brace. Make sure you brush the back of the mouth very well. You also have to brush the biting surface of your teeth and also on the inside of your teeth. This is not only for the braces, it's also for the inside and the biting surface of your teeth. One of my staff members also handed you a fluoride script, which looks very similar to this. This is very important because fluoride should be used on a daily basis in order to prevent cavities and white spots from forming around your teeth. When you receive this from the pharmacist, it's going to look like a tube of toothpaste. I want you to use this before you go to bed. I want you to put a small pea-sized drop of this fluoride on your toothbrush, brush it all around your braces, and then spit the excess out. Now, I've written this so that your pharmacist can give you a generic form. What I want you to do is read the instructions on the bottle that your pharmacist gave you so that you're using the fluoride properly. Once again, very, very important in order to prevent white spots on your teeth. Now I'd like to talk a little bit about diet restrictions. One of my staff members also gave you a form similar to this. What this form is telling you is the foods that you should avoid when you're having your braces. You don't want to eat very hard, crunchy foods such as ice, nuts, or peanut brittle. You want to stick with softer foods. If you do eat apples, what I want you to do is cut those up and push them to the back of the mouth so you can chew them with the back molars. Also important is not to chew on pencils and pens. We have a lot of students in the practice that break a lot of braces off while they're in school because they have a tendency to chew their pencils and their pens. A common question I also receive is, can I chew gum? And the answer is no. You want to steer away from gum. It sticks on the braces and also could cause the wires to bend. Now I'd like to talk a little bit about some dental emergencies that may occur when you're in braces. The last thing I want to talk to you about is what happens if a brace comes loose or if you have a poking wire. The most important thing is use some wax if something is bothering you. That way the discomfort will go away. If you happen to lose a brace and it actually comes out of your mouth, make sure you save the brace for us so at the next appointment we can place it back on the teeth. If you do have a poking wire, what you can do is clip the wire that's poking you with a fingernail clipper or a toenail clipper. Now, if you're unable to do that and you need some assistance from us, please give our office a call. If we're not here, you can call me on my cell phone, which will be on the answering machine. I can talk you through most dental emergencies on the phone. You don't have to come into the office. Well, I hope you enjoyed your oral hygiene presentation. If you have any questions, please ask me or one of my staff members, and I hope you have a great orthodontic journey.